I'm Dana Mulhern. Dr. John Miller, I can't see him, he's here. And Jatinder Sidhu is here as well as the moderator, but we are also the founders and the executives of Positive Voices. First, I'd like to acknowledge that we are residing on the traditional and unceded lands of the Musqueam, Squamish, and Tsleil-Waututh nations. And it's my great pleasure to welcome everyone to our first informal informational Zoom meeting hosted by Positive Voices. We came together about a year ago as a group, hearing from you, the community, that we needed a strong positive voice. We're now organized as a not-for-profit group, and we're dedicated to drawing our community together. Our mission is to supply accurate information, to inspire and advocate for progressive initiatives that address our grave environmental challenges, create diverse and affordable housing that we definitely need, reduce traffic congestion, and enhance our economic and social well-being. So as you can see, we have many issues to talk about, and we're very lucky to start the program tonight with Jatinder and Baptist Inglewood Housing.
Thank you, Dana, and thank you everybody for sparing the time this evening. Just by way of introduction, my name is Jatinder Sidhu. I have been visiting Vancouver for 30 years, and 4 years ago had the immense privilege of being able to move here with my family. I'm a journalist by training, worked at the BBC for 21 years. Now I'm freelance. I am independent, as we all are, of Baptist Housing and indeed the District of West Vancouver. We, in Positive Voices, are really just trying to do our bit for the community, because we have some sort of strong values that we feel we want to really help move forward, as Dana has said. Now, we're here this evening to talk about the care system, and it's not it's not a mystery. It's not sort of news to talk about the care system in general. To say that it's pretty uncoordinated. It's pretty much been in crisis. COVID demonstrated very clearly that there are significant shortcomings in the delivery of care, whether that be at home or in residential settings, or even continuing care for people with disabilities. So one policy briefing I saw recently described it as more an underfunded patchwork of services heavily reliant on for-profit delivery than it is a system of care. And this is particularly important for a place like West Vancouver, where we have some challenging demographics. The latest figures just out a couple of weeks ago, the proportion of seniors, that is people 65 and above, across Canada is just below 20%. In West Vancouver, it's almost 34%, and it's growing fast. So this large and growing population of older people means we have a responsibility to provide a decent level of care, both in the home and in residential settings. The average age of people entering long-term care settings is 85. The number of people in West Vancouver who are 85 and above is 2,400, just in West Van. And according to Vancouver Coastal Health, there are a mere 1,070 funded beds across the North Shore. So we have a shortage of long-term care beds today, and that shortage is only going to grow. So without further ado, I'm going to introduce our guest, Terry Griffin, the Chief Operating Officer of Baptist Housing, to talk about Inglewood. But just a couple of quick housekeeping issues to mention. This is recorded, so bear that in mind. When you want to talk, please raise your hand, go to the bottom of your screen and click on reactions or raise hand, and then lower your hand after you've had the opportunity to ask your question. You can also type your questions into the Q&A box, which is also, the link is on the bottom of your screen. Please ask questions rather than making comments, and keep it brief. But without further ado, I'm going to ask Terry Griffin to give us a little presentation. Oh no, I think we're having the video first, is that right?
Well, thanks, Jatinder. Yeah, I think that before I get started on a short presentation, just a little bit about Inglewood and redevelopment plans, we do have a video we wanted to share. So we will start with that.
Typically, the start of the journey for most of our residents is being alone. They end up in an apartment alone, in a house alone, the kids are gone or the spouse is gone. In a campus of care, right from the start, right at affordable housing, you now have neighbors that are all in the same boat as you.
It allows for people to live together in the same campus of care, even though they might be at different levels of need. And so you could have someone living in independent living and also have a spouse or a partner living in long-term care, and they can spend every day together. They can spend meal times together.
It sounds wonderful. As long as there's something peaceful. It feels too good to be true. Too good to be true. That kind of a place would be to honor the old people. They earned it by building up the country and all that they've done. I think if they can establish even thought to do that, I think it's wonderful, wonderful, wonderful. In my dream of old age, because I remember my great-grandfather, I remember that, and he was just in a separate little house on grandfather's property, and that's how he lived. These kind of care homes, or whatever you want to call them, have been in existence in Europe for many years. It hasn't been here.
We did a lot of research into what's the world doing. And the world is way ahead of Canada. We need to catch up with that. This is not a place to put our seniors anymore. We need to build a community for them.
Thank you, Terry.
Great, thank you. That's just an opportunity, and those are Chris, who is our administrator at Inglewood, and those two ladies, we have the privilege of having them live at Inglewood. So that's the West Vancouver seniors right there. So we wanted to just, again, go through this presentation fairly quickly, leave lots of time for questions. Just to tell you a little bit about Baptist Housing. We have been around for about 58 years. We are all about providing seniors care. We're a nonprofit society, so we've been doing this, again, for 58 years in many communities, West Van being one of them, but we also operate in the interior around Kelowna and also on Vancouver Island around Victoria. ZGF is an architect team that's been the team we've worked with in designing this project, and we've done projects with them in the past as well. So that's just a little bit about who the project team is. History of this project has been interesting. We were invited in 2018 by BC Housing to enter into this acquisition discussion. Inglewood, as we know, is an old building, and there was recognition right off the bat that it was a building that would need to be replaced. There's 230 long-term care suites in Inglewood now. 34 of our residents currently share in double rooms. It's an institutional setting, which is what it was like 60 years ago when it was built. Lots of long hallways with rooms off of the hallway. a sort of a nursing station at one end, and common areas in the center. So we've got Inglewood. Just to tell you a little bit about Inglewood, it's part of the history, is just an amazing team. And I think you get a feel for the two ladies on the video, just an amazing group of residents and team there that serve in challenging situation when it's an older building. Provinces stated, and oh, sorry, back one more. Thank you. Just wanted to share here, the vision is to redevelop Inglewood, and it has been right from the early discussions of acquisition into a continuum of care with 700 units. And we'll talk more about what the campus will actually look like. Thanks, Lauren. So this is a drawing of phase one, and I like to look at this one because it gets me excited. The grayed out sort of beige shape in the front is the current Inglewood building. And as you can see, the plan is that the new building is it's split into two, and it will be built while the residents continue to live in the home that they're used to. So it'll be a very seamless opportunity for the residents to move into new space without any moving elsewhere and then having to come back. So it's just really exciting to see how architects were able to fit the new buildings around the old building. And this is phase two. So we can see again that the LTC in kind of upper left of the screen and the LTC to the right of that are what we just looked at. And then the rest of the buildings sort of show how the campus builds itself out. So it's different types of housing, again, all in one location. And it just fits who we are. We are builders of community. You heard that in the video, that's what residents are looking for. And so this just shows you a depiction of what that community would look like. This comes out of Vancouver Coastal Health built brand new design guidelines for long-term care. And as we were beginning the design process, we were able to collaborate with them and view the design guidelines that they had put together. So this is really informed by our experience with the pandemic. So it's a small household model. I mentioned to you earlier that the model that's at Inglewood right now is dated, and it's the long hallways with resident rooms on each side of the hallway. It looks more facility-like, whereas you can see here that this is built more to look like an actual household. So it's just such an improvement on the current model of a long-term care building, or a dated model rather. So a couple things I would point out here is there's separate space there. You can see in the teal right near the center of the circle, it says visitors. So that's one of the really exciting parts of this. Is we had an experience during the pandemic we're all familiar with, where visitation was really dialed back and closed at many points. So this design gives opportunity for visitation to happen where visitors are not entering other resident spaces. It's actually purposely built to be able to have visits without any kind of movement into other resident space. So that's something, every time I see that, it's exciting. We might be frozen. I could keep talking about this, but oh, thank you. Indigenous reconciliation, we just felt like we couldn't talk to you about this project without a slide about this. It's been important to us to be in consultation with First Nations, so we have been doing that. It's still early in process of this whole redevelopment, but we've got a few things on the go in process with Squamish Nation. So Salmon Safe is a program that we've committed to. There's some archaeological overview assessments, speaking with the consultants around land design and plantings. and also stormwater management. So we have expectations to do, once we're operational, this would look different, but in the design phase, these are the kinds of things that we're speaking with Squamish about now. And sustainability, I think, again, right from the very beginnings of design, we've taken, it's just such a beautiful setting where Inglewood is. It's just beautiful. And you could see in the video, one lady was twirling a piece of greenery in her hand. It's just surrounded by such beautiful spaces to look at. So we've taken, right from the beginning, there's been a real holistic environmental stewardship approach. And you can see in the slide here, again, about salmon safe, did an energy study to look at future climate adaptability as we move forward in time. Looking at low or no volatile organic materials for construction. So there's been a real focus on these kinds of things right from the very beginning of design. And West Vancouver community, I'm speaking to the West Vancouver community, but a few things I think are important here would just be that West Van's lost just shy of 300 care beds in a pretty short period of time with the closure of West Van Care Center and the Capilano Care Center. So right now, Inglewood is the sole funded long-term care community in West Van. We, as part of our development proposal, when we were looking at the campus, we are also proposing the addition of 120 suites onto the Inglewood campus, just in recognition of the huge need for more long-term care in West Van, so that the residents of West Van don't have to leave West Van. We know that there's a community interest to keep funded care in the district, and so we went ahead and created the design to have another 120 beds included. The province, we know, has made substantial commitments to the redevelopment of care, and I think the invitation to talk early on around Inglewood just shows the commitment that they have to that. And our next couple of slides are some artist renderings, I'm visual, so I always like to see, this is a rendering view of the courtyard. Again, a space to really create community for residents that live in all types of buildings. And I think there's one more with a view of the courtyard in a different season. There we go. So that's more from ground level. So lots of spaces to sit and visit and hopefully build community between buildings, and just share life together. That is, I think, the last slide. Yes. So thank you. All the information that I shared here is on this website, renewinglewood.ca. There's much more on that website, so I invite you to go on and take a look. If there's anything that you wanted to look further at or just have more information, it's all available there. So thank you, Jatinder. That's my presentation.
Thank you very much, Terry. So we will kick off with a question on the visitation, let's say broadly. We know that COVID-19 affected many families' opportunity to keep in touch really with their loved ones, and a particularly scathing report from the I think was it the seniors advocate in BC who said that this was incredibly corrosive to family ties and to the well-being of seniors. So I know that some thought has gone into the design of this facility in relation to infection control. So how has COVID-19 informed the pandemic? I mean, the particular question was, I love the visitor space, but would that not be impacted by what we've been through with COVID?
Yeah, well, really the design of the small neighborhood, the most significant thing I would say where COVID-19 did inform it, you're right, is that the neighborhoods are smaller and self-contained. So in a building where you've got a long hallway and residents, many residents, 40 residents down a long hallway, viruses have opportunity to move and move quickly. There just isn't opportunity to isolate and keep people separated. Whereas in the small neighborhood that we're looking at, you'd be looking at a neighborhood of 12 and essentially able to completely self-contain that neighborhood. So there's that does create some duplication. So you do have two laundry rooms, and you do have 2 areas to store things, and there's some of that duplication, but it allows you the ability to very quickly close off, so to speak, one neighborhood and not affect so many residents in terms of what you need to modify in their day. So that's really, I would say, the largest component of the new design of this neighborhood strategy, is being able to self-contain quickly. And so you're able to get food on one side and not the other. It can look very different. Yeah. So
that's what happens in a situation, you know, in the middle of a pandemic, or when there is an alarm sounded, as it were. Somebody else has asked about residents of one building able to visit or enter into the other buildings on the site. So this would speak to the idea of this sort of community of buildings, this neighborhood, where you have people in different sort of settings appropriate for different stages of your life, really, your journey. So how would that work?
Well, we've got this situation in a couple of locations. So visitation is open to anybody. So you're able to come, even in pandemic, there were different levels of visitation. There was essential visitors. If visitor was required to assist with care, they were able to come in. But I'll talk about normal world for now. So the residents could have visitors come and go at any time into their suite or into the visitor spaces that are available. And these smaller neighborhoods do create more of those smaller visitor spaces, because you've got common room on both sides of the neighborhood, and people can come and go. Again, in a non-breakout time, can come and go to even visit friends in another neighborhood. So and we're really hoping that courtyard gets used to the outside space to be able to sit together and have a coffee.
And let's talk about another sort of significant part of this project, which is to have quite a large body of staff on site. So to tell us, if you would, about the plan to have those staff residences. Do staff want to live necessarily close to their place of work? That is a model that has existed in a number of countries. In the UK, for instance, where I'm from, teaching hospitals, often medical students perhaps would live on campus, nurses. But what about the demand? Has it been tested amongst the staff, for instance?
Not formally, but we have heard lots of informal interest in it, lots of questions, lots of asking when. So we have a lot of our team who bus to work. And so the idea for them of not having to have that kind of commute, it's not been a reality for them to be able to live near where they work. And so there seems to be quite a bit of excitement at the possibility of not having to have that bus ride. Yeah. And
just sort of connected with the staffing, really, one of the major alarm bells sounded during COVID was the absolutely appalling levels of staffing in many seniors care homes. What is the expectation on your part for the sort of, specifically the nurse or support worker ratio to residents? And presumably it gets higher and higher, the higher up the ladder you go to long-term care facilities.
Well, there is the health authority provides us with funding based on hours per resident day. So, right, that's something that is given to us, and right now that is 3.36 hours per resident day. And as we've looked at this building and the smaller neighborhood design, we have been talking to Vancouver Coastal about that being higher. And, you know, those are discussions that will be ongoing as it gets closer. So we've created staffing plans with a higher number in mind.
So we have a question about, is there any senior daycare or part-time drop-off included in your program? I know we have an adult daycare facility, which I believe currently is in the Kiwanis building, but is due to move to the new site on Gordon Avenue when that building eventually comes into being.
We have got large common community space built into the design. We have not gone forward with formalized, finalized plans on what that space would be, but that is one of the things that's been discussed.
So just one more quick question on the occupancy. Is there provision for double occupancy? So a couple could live in, you know, maybe it's the independent living suites or even the long-term care settings. Could that work?
There's lots of 2-bedroom, so I'll say double occupant, but there's lots of suites in the independent living building that could house couples, 1 bedroom, 1.5, and then 2 bedrooms. So that's certainly in the plans, and that's a very common. We have lots of couples living in independent living. In long-term care, each of the rooms are individual with individual bathrooms, but there's a plan to have some connecting rooms so that if there was that desire, that's something that could be accommodated.
So I'd just like to remind everybody that if you would like to ask a question live, please raise your hand and we will sort of allow you to speak. You won't be in vision, so to speak, but you will be able to speak to us using your microphone. So returning to questions, so we've got a question about the sort of ratio, the mix of the private pay, speaking about the 10 private pay in long-term care. So the ratios are pretty high, 350 publicly funded long-term care suites. Just in terms of the overall sort of economics of the project, I mean, is it fair to assume, and maybe it's not, that all of those, the people who are paying the sort of market rate would be to some extent subsidizing all of the affordable care, the affordable seniors housing, and some of the other housing, and so those people will be paying much higher than the going rate, so to speak.
I'm not sure. I'm not sure I understand the question. Sorry, Jatinder.
Yeah. So really, if you are, I mean, just in terms of the, you know, there are 210 units, I believe, which are market rate. Is that right? The independent living suites.
Okay, I'm with you now. I'm with you.
Private pay long-term care funding. So are they in effect subsidizing all the others?
No, the long-term care is publicly funded, so it would look after itself in terms of operations. And, you know, affordable housing is in partnership with BC Housing. And the details of the funding are not yet, you know, concluded, because that one's a further phase. So no, I don't think it's a clear line to say that the independent living is subsidizing the care. No.
Okay, just having a look at the questions. So West Van has just lost shy of 300 long-term care spaces. Inglewood has 230 suites and 34 sharing. In your new complex, how many long-term care beds will there be? Well, that's pretty simple. That's 350 fully publicly funded long-term care suites.
That's what our proposal says, yeah.
There's been some sort of comment and discussion around the overall cost of the project, because you know, it's a lot of money in total. It's 500 million, $500 million. Did Baptist Housing pay over the odds for the site? I mean, I've seen a couple of figures for how much the site cost, and would that cost eventually have to be recouped by residents?
I think the best way to answer that is that there's a lot of partners in this project. BC Housing is a significant partner. Vancouver Coastal Health is a significant partner. And so the costs are not borne by any one partner, but, you know, within partnership. So I think without those partners, it wouldn't be something that would be able to be developed. But the partnerships create the opportunity to build and have this housing available to seniors that is funded by the province for them.
Okay, we have somebody who'd like to speak. John Miller.
Can you hear me now?
Hi, John. Hi, John.
Hi there. So you went through the numbers there quite quickly. What is the total number of units? How many people will be living in here?
Well, we'll be replacing the 230 current beds that are in the current Inglewood. And then we've proposed that on the phase 2 build, that those are all funded beds as well, which is 120. So that's 350.
I see. Okay, thank you.
Yeah, you're welcome.
Perfect. That's all for now. I'll come back later with another one.
Can I ask Terry, on the sort of broader question, when we think about, I mean, the continuum of care, not in relation to this project, but clearly for many, many people, when they start to need the kind of care which is difficult for one's partner or family members to provide, you call upon care assistants, support workers, care support workers to come to your home. And that is very often the thing that people say they want to continue doing, you know, right through. So there is sometimes a kind of reluctance for people to support funding or, you know, a residential seniors care, because they think, no, you know, I would never want to go there. I'm always going to be at home. So what about that sort of balance of, you know, where public money should be going? Why should we be funding a big, expensive, you know, admittedly very, very complex a facility like Inglewood?
That's a good question. I think that everyone's needs are different. The experience we would have is that in independent living, that's a choice people make when they're still able to be fairly independent. They don't need a lot of care, but they're able to get home supports come into their home. But meals are provided, activities are provided, that social interaction that we all know is so important is something that's available. So that's one option that people can make use of. So you can age in place by getting that home support come in. And then I think that long-term care is really when the care needs are so high, they're difficult to do at home. You're often talking about significant mobility issues, issues with diet and feeding that are really challenging to support your loved one at home with that. And those kinds of things, being able to have, you know, access to sling supports and ways to help move residents in a safe way that a spouse or loved one just maybe isn't able to do. So I think that the long-term care offering is really when care at home becomes really difficult to do, or even not possible to do.
And on this sort of continuum of care idea, I noticed that people could start moving onto the campus from the age of 55. Well, I'm only 4 years away, so but that does seem, you know, relatively early. I mean, is there the expectation that because I've also heard this phrase multi-generational, that people might want to move in perhaps at the same time as parents? I mean, how would that work?
Yeah, well, I think that the affordable housing building is where we're really going to see some opportunity for multi-generational living, because the workforce housing would be, you know, have families, it would have people of all ages. So that's really the opportunity to have children around, to have all kinds of people from different age groups. That's the building where that will likely come into play. I would also add that, you know, in funded long-term care, it isn't always people who are 85 or 65 or even older than 55. In our province, if you need significant complex care, you would live in a long-term care home, and you may be younger than the other residents there. So that's another opportunity that you see that when you spend time in a long-term care residence, that there is different ages that live there.
So there's been some considerable discussion in the community about the location. You know, a question posed by Barbara, she says this is a huge building in an unsuitable location. Why not build it elsewhere, like where the old Capilano Care Centre is, or even the Clewick site, as she says. I mean, I noticed that the Capilano Care Centre, which is now, I believe, closed, is zoned for seniors care. I mean, aside from the fact that Baptist Housing didn't buy that site, you know, what about that? You know, why that particular location for this particular project?
You know, that is a good question, and I don't know. I think that the land at Cap Care was not considered suitable for what we were looking at doing. And that's the most detail I can give without, I could go back to my team certainly and answer that in more detail about what was it about that land that wasn't suitable. So I'm happy to do that.
And the question of traffic, there are some people in the community, particularly residents in the Cedardale area, who already have to face the fact that they live next to a provincial highway. So, you know, whether it's the school run or, you know, weekends, all times of the week, really, they do suffer from this horrendous traffic jam that they have to navigate. This project is inevitably going to increase the traffic flow coming to and from the area, is it not?
I know that traffic has been a really important part of the studies and work done, and we've been working really closely with Ministry of Transport and West Van on that issue. I think one of the significant things is that the planning for flow of traffic is underground. A lot of the movement of vehicles is underground, so entering the site, and so taking it away from driving through neighborhoods, so to speak. That was an innovative way of looking at that issue. And then in terms of other traffic flow patterns, we've worked really closely, in any kinds of requirements on that have been met. We've tweaked and changed things to try to do the best we could with that issue.
A really interesting question from Laurie. She says, what is being proposed for innovative dementia or memory care at the new facility? A really striking thing in a book I just read by the Globe and Mail columnist Andrea Picard is that many, it's called Neglected No More, I recommend everybody read it, is that many seniors care facilities have no real ability to deal with patients, with residents with dementia. So there are no safe spaces for them to wander around, for instance, and they have to be kind of contained. And that's a horrible thing to see happen to one's parents.
Yeah, that's absolutely agree. And I would agree that's a great book. In terms of dementia care, we have a lot of experience with that, and with the Inglewood design, again, using the space and the beautiful surroundings, our residents, there are contained outside spaces that would be attached to those kinds of communities that are more secure, and there's secure outdoor area as well. So it's really creating not just a hallway that's got a locked door at the end, but an entire community that's got kitchen space, that's got activity space, that's got an area to sit and relax, and an outdoor space that is still fully secure. So again, the design, I think, has done a really good job of taking that resident into consideration.
Charlotte asks, are there benefits in having a non-profit build and operate this facility? Do profits remain in the community?
Yeah, great question, Charlotte. I think we all hear a lot about nonprofit, for-profit, and don't always talk about what does that mean. So yeah, I think that it's fair to say the positive of nonprofit is it is our intent to reinvest in the community, and that could look like all kinds of things. I won't go into the exhaustive list, but there is no profit sharing program. There is no expectation of shareholders to deliver a bottom line. So you really are trying to operate, and leftovers cycle back in. So I think it's a great model for building in West Vancouver. Oh, I lost my video. So that would be my response to that. There's no expectations of others who own shares in your organization.
Somebody asks that in terms of the demolition of the current building, and this is really a question about sustainability, and have you considered a company such as Unbuilders, who ensure the building components are removed for reuse and do not become part of landfill?
I love that. Unbuilders. I will have to get back to you on that. Is it UN, just like it sounds? UNBUI? Yes. Okay. We will get back to whoever asked that question.
So there's a little bit of confusion still about the numbers. Janet asks, what is the net gain of long-term care beds, keeping in mind that 300 plus beds are lost and 264 beds are currently available in Inglewood, for a total of 564 beds lost? How many long-term care beds will you provide?
I'll clarify one thing there. I think we're getting mixed up. There are 230 beds at Inglewood. 34 of those are shared rooms. So it's not 264, just to be clear. And so the net new, so to speak, is the 120 beds that we're proposing be funded in the second phase.
And just to clarify that, I believe originally it was, I actually don't have that figure now in front of me, it was a lower number, but following consultations and indeed requests from councillors, there was a call. I saw references to councillors such as Councillor Peter Lambert calling for more long-term care beds to be provided in the facility, really calling for Vancouver Coastal Health to step up with funding. Is that right?
Yeah, that is definitely right. We changed our design plan to incorporate another 120 long-term care beds, based very much on feedback from the community and the recognition of the really quite sudden loss of those almost 300 beds. So we incorporated that change. That's where we would like to go.
Okay, did something strange happen there? Okay, right.
This is probably Jordan helping me. Thank you. With just so that we can all look at the numbers and be clear on that.
Right. Yes.
So the large green puzzle piece on the sort of the 10 o'clock, 11 o'clock noon part of the pie here is the current 230 funded suites. And then in addition, we've got the 10 private pay that we talked about earlier on the right-hand side of that. And then on the sort of 7 o'clock space is the 120 proposed funded suites. So hopefully that helps with the numbers. So we're currently at 230. And I missed when I was doing my math, I'm sorry. 120 are proposed in the second phase. And then, of course, the 10 private pay that aren't there today. So this that makes it a little clearer. Thank you, Jordan, for bringing that up.
Yeah, and I think we should probably leave that up so people can really digest that. Questions around how far this will really benefit local residents. So Barbara asked, you've alluded to the 350 long-term care beds being for West Van residents, but that's not how Vancouver Coastal Health works. You have to take the first bed available wherever they may be in Vancouver Coastal Health Authority area. So what about that sort of ensuring that, I mean, that doesn't only apply to the long-term care beds, but also to the affordable housing. I mean, there are many, many seniors in West Van who are really, really, you know, sometimes asset rich in their homes, but extremely cash poor, who kind of, you know, need help or maybe need to downsize.
Mm-hmm. Yeah, with funded long-term care suites, the question's a good question. There's now 3 choices that you put into the health authority as your choices of where you would like to go and be placed. So it's changed a little bit from the first available bed idea. But I recognize it isn't that you can just say, this is exactly where I want to go, unless you choose to wait and just put that as your only option. So I recognize there's difficulties in that system that aren't in our control, unfortunately. But I think that with the three options, that it gives more option to residents of West Van to stay in West Van than by having more beds available in West Van.
We have a question from Jay Brook. Could we hear Jay Brook?
Hi, can you hear me?
Yes.
Yes. Oh, thank you. It's been a very interesting presentation. I just wanted to chat briefly with you on this info that I read in your background material. It stated meet Baptist housing's specific thermal energy demand intensity targets by focusing on envelope performance. And I wanted to say I'm very much in favor of passive house type buildings because there's very little need for space heating. Mm-hmm. So Terry, are you able to comment on at this stage what are your plans in terms of you know, trying to reach a certain climate friendly goal here?
Mm-hmm. I can't comment specifically on that system, but I can certainly get back to you on that. There's been a ton of work on this piece, and I will admit that the phrasing and the terminology, I could not answer your question, but we will be able to get back to you. There's been a lot of work on that.
Okay, and I'm just not clear on how it works when you get back to me. Is it Jatinder, since I registered, you have my email ID, correct?
Why don't I figure it out?
All right.
Yes,
Yep.
we'll figure it out.
Yep. And I could put it in the, well, yeah, I can't put it in the chat, but yep, you figure it out before we're done here. Thank you so
Yes.
much.
Great.
I'll
And
make a note. I'll find you.
yeah, we'll
Yep.
give you as much detail as we can about your questions. Good
Thank you.
question.
Thank you.
And just more on the sort of sustainability green question. You know, it is a little bit difficult, isn't it, this location in terms of walkability, bikeability. I know that some people have said, oh, it's impossible, it's too far to, for example, walk to Park Royal. You know, from experience, I know that it's a sort of 10-minute brisk walk, 20-minute slow walk. But what about shuttle service for tenants, for instance? I didn't see anything of that kind in the literature.
Yeah, we've got plans with independent living. It would be really typical that we would have, I wouldn't call it a bus, but they're the larger than a van, a mini bus that we use for residents for activities. And it's definitely part of what we do to take residents to outings, to appointments, and it could very well be that it's to Park Royal. So it would be in our plans for sure to have more than one of those. Independent living, long-term care also would have one. So that's certainly within the plans, yes.
A question which really goes to the way that planning processes work, particularly in a place like West Van. You know, there is the official community plan, there are local area plans. This, I believe, project falls in an area which would be part of the Taylor Way local area plan, which is something which, you know, isn't really on the horizon at the moment. There's Ambleside is due to happen next. It may take quite a while. And so there's sometimes quite a lot of concern and opposition expressed by residents who say, you know what, we shouldn't do anything until we have the LAP in place. I mean, you know, what would you say to those people who say, no, you know, it doesn't fit in with everything else that we eventually will have a plan for?
Yeah, I understand for sure the concern of wanting to have area plans developed, but I think we've talked about the huge need that is now in West Vancouver. Not only with the current Inglewood building being as old as it is and in need of replacement, but also with those vacated care beds that are now out of West Vancouver. I think that's really driving the need to do this now.
Can you talk a little about life leases? So this is a kind of interesting idea that you effectively, I believe this is in the independent living suites building. You kind of buy into it, and it's a kind of, you know, it's, I don't know, you pay your money, you get to live there, and then you get your money back. You know, well, how does that work?
It's one model being considered. We do not have any other buildings that are life lease, so it would be a new thing for us if we were to go that direction, but it's popular in other provinces, and we've got lots of them in BC as well. So yeah, the idea is that you buy in, and then there's an exit model that you get the bulk of your money back when you depart. And so it's just another way of looking at it, that you sort of prepay your rent, so to speak. And then you would be paying a monthly fee like you would, you know, buying into a condo with a strata fee type of idea. So it's one model we're definitely considering, but haven't landed on whether or not that would be the offering in the independent living.
And the questions over the impact on the neighborhood. Barbara asks, and if I'm guessing Barbara may be a resident of Cedardale, you know, the immediate bordering neighbors, how do they feel about this development? Are they being compensated for what may be a loss in their property values? Not really sure who would compensate them.
Yeah, I can say that I am not aware of any compensation that has occurred or would occur in that case. I think that we're looking at it that Inglewood's been part of the neighborhood for a long, long time, and we're hoping to be able to create a development that remains a great neighbor and is not something that detracts, but is seen as a positive for the neighborhood.
Okay, John Miller had his hand up before and his hand is still up. He did threaten to come back for another question.
I think I understood that in terms of the affordable housing, you can't tell us exactly what the dollar amount was. That would be below market, I assume. You don't know how much at this stage.
I am not able to tell you how much at this stage. That's still an open discussion, but I can tell you that it's a BC housing partnership. And so it would be below market housing, absolutely. To be able to get into numbers this early is just difficult. Yeah.
And the other quick question is, this is described as a faith community. Do you have to have the faith to get in?
No.
Oh, good.
No. Yeah, Baptist housing comes from that background, but the communities, no.
And just going back to the Indigenous question, you mentioned
Yes.
archaeology, salmon, and so forth. But what about the Indigenous community? They too will have equitable access to this place.
Absolutely. Yeah.
Good.
Absolutely. Thank you.
I must apologize to Barbara because I suggested she might be a resident of Cedardale. I may be wrong, of course, I don't know. Moving swiftly on, I mean, just the broader picture that I painted, I think we need to wrap up. I think we are pretty much done with questions, but very brief, actually, why don't I ask you to wrap up, and I'll maybe ask a question while I ask you to wrap up. You know, we have a bit of a crisis in seniors care. We have really, according to the experts and people who've really sort of studied this, you know, an underfunded patchwork of services. We have great concern about for-profit. Research clearly demonstrates a pattern of lower quality in for-profit homes. I mean, what would you say is the broad sort of solution to what would you see, given your experience and the experience of an organization like Baptist Housing, to the care crisis?
Wow, that's a toughie. I think that, you know, when you look at a development like this that's got a campus, I think that there's some real benefits in the community aspect of that. And I think, and it's in Andre Picard's book, and it's in lots of other research, certainly the Seniors Advocate talks about the value of community and the effects of loneliness on seniors. So I think I would start there, that having seniors communities that really focus on building community and creating opportunities for seniors to interact with others is a really significant thing we can do. And then I also think, providing long-term care is not for the faint of heart. It's a really difficult time now to have with staffing. So I think another comment I would make is that sophistication and an ability to understand this space is also something that is helpful. Because it's not easy to navigate providing funded long-term care. And so I would suggest that's a positive as well, with having a nonprofit provider that is in this space already and has done it before. Yeah.
So it's 8 o'clock, so we have to wrap up. Just so everybody is aware, the next steps are, it is due to go to council. We don't know when that's going to happen. There'll be a presentation, first reading, and council have the option of sending it to a public hearing. And again, there has been no date set for that. once that process is completed, there'll be rezoning and development permit potentially issued. But there is a phase of public consultation. I hope everybody who turned up today did learn something. There's plenty of information on the Renewing Inglewood website. There's also the District of West Van website, which has a lot of background information. Thank you very much to Terry Griffin, and I think that's pretty much it.
Thank you, Jatinder, and thank you everyone for great questions. Appreciate that.